Alright, let's go.
Alright, let's take a look at our weather forecast today.
Today's forecast, a lot of sunshine, blue skies, marine clouds. Just a perfect day to go outside and relax. That's your forecast. We'll be right back.
Yeah, sunny days, sunny days, sunny days.
Hi everyone, Dr. Anjana Bana here, and welcome back to my YouTube channel and to our practice kitchen. Today is another episode of Kitchen Q&A where we are fielding all your interesting questions that you've sent through. Without further ado, let us welcome Sheetal and Zakia on set. Questions we have gathered over I mean, these questions is like this amount was probably us in a day or two. So there's some random questions in here, so you can pick some hot question. Let's hope it is a hot question. Okay, what does yours say, Zakia?
Can I have alcohol before Botox?
Wow, I don't know. You know, from the previous video we did, it's like these questions, we honestly do not plan them like this. You should not have alcohol before. I'm just thinking, you know, when you think of patients that have had alcohol and they come to you, like, you know, going in your mind. But no, you should not have alcohol. You must be of sound mind when you come see me or see any other doctor because you sign a whole lot of consents. Also, it increases your blood flow, makes you more prone to bleeding and bruising. Also afterwards, most of the treatments we prescribe, I mean, even if it's a chemical peel, we just advise no alcohol afterwards. And I know people don't listen to us, or the next day is like, oh, I know you told me, sorry I forgot, I had a whole bottle of blah blah, will I be fine? And yes, they are fine most of the time. It's mainly to do with post-op bruising. Also, yeah, blood flow increase, and you know, it decreases the I would say like the efficacy of your treatment. And thinking of when I just started out, of course, when you're inexperienced, and you might not be able to, you know, put your foot down. I did have someone who came from an office party, and, you know, being naive, I didn't think, well, how much can you drink at an office party? Straight from an office party to me, and I was doing the treatment, and luckily not too much bleeding, but she was snoring the entire treatment away, and I was like, I will never do this again. You know, this is a lesson to me. They're coming from an office party or going to an office party, no aesthetic treatments on the day. Yeah.
So I've got a treatment for some.
Yes.
So should I book sculpture or profiler? So mainly, what's the biggest difference?
What's the biggest difference?
Can you have them both done?
You know, if you are able to, of course, I'd like to say yes, have them both done, but it's also very patient specific. So they're both a type of biostimulator. And I'm going to go like into detail with this. I'm not even sure if it'll be one video that will be able to do a Sculptra versus this biostimulator or whatnot. But Sculptra, polylactic acid, is a very powerful biostimulator. It's injected to the lateral face, so like on this side, behind the ligament, so it gives you like a lift. We try not to inject it into, they call it the mobile face, the medial face, because it'll give too much bulk in the area. And it also, you know, over time, depending how much Sculptra you need, because the older you are, and if you're postmenopausal, you might need more treatments than, say you, Sheetal, I mean, 2 minimum, that, like the 2 minimum treatment would be perfect for you, or even for you, Zakia, like between you and I, maybe 2 to 3. The other thing, you know, maybe Sculptra is more costly than Profilo, so that might be a deciding factor. But the thing with Profilo is they've got these things called back points where you inject in specific points to also improve laxity, which is something that Sculptra does. But we modify it, so you can inject Profilo in the mid face, so you can use them together. But if you want intense biostimulation, and if you're an older lady with a lot of skin laxity, lots of volume loss, I would still go the Sculptra route. You just have to be more patient with your results. Profile, you can see it straight away. It's almost like a finishing touch maybe for a patient like that. If you're a young man, like we see a couple of younger patients, well, actually they look young, they're not actually that young, it's just that they have treatments, but good quality skin, you can get away with 2 profilos that you repeat every 6 to 8 months. And also, I'm not going to give too much away here, but we do a lot of combination treatments, and we've got some interesting profilo combinations that make it a bit more, enhance it a bit more and make it a bit more like effective. So it's patient dependent. But yeah, if you're very lax, I would still go Sculptra. Still really good skin quality, Profilo. Yeah. Okay. Like a maintenance or an icing. And then, on top of the cake, and the Sculptra is the cake. So, yeah, I hope that's okay. Do you guys have any? Let's pick another question. What's your question?
Why can't I touch my face immediately after Botox or fillers?
Did someone actually ask this? Yes.
We do, yeah.
Yes, why can't I touch my face? Because you can't. No, okay, so you know what? I'm sure as a patient of mine, you've seen we disinfect. When you come in, we disinfect after the numbing, in between. It's really important to keep the area clean. Our hands go all over the place, full of germs. We create little needle entry points, and we just want you not to, increase your risk of infection because we've opened up the skin. Fillers stick around for a long time, and germs love fillers. It's like an amazing sugary treat. They can form something called a biofilm around it. So it's important to keep the area aseptic, and then afterwards I mold, and we have a gel, like a HOCl gel that we mold with, and HOCl is anti-inflammatory and as well as a disinfectant. So I don't want you to touch the filler, move the filler, squeeze the filler, anywhere. Where I've put it is where it stays. And also you tender afterwards. So you don't want to be touching that tender area. You can cleanse your face later on in the day, but don't unnecessarily touch it and touch where we went in, because that will increase your risk of infection. Botox also, Botox is a liquid and it has to be injected into a specific muscle in a specific depth depending. And if you press it, or if you put someone want to go out on a motorcycle breakfast run straight after, you can't, because it'll spread and it'll go to muscles it shouldn't, and you'll get a undesirable results. So the less touching afterwards, the better.
Okay, yeah. So exercise?
Exercise, you can go for a light walk, but I wouldn't go, I was going to say pole dancing, but whatever. What do they call it? Pole fitness and whatever. Yeah. Pilates and lifting weights and, where you're upside down and whatnot. So on that day, definitely not. Okay. With filler, and depending on the extensiveness of the filler, the next day also a bit tender. So maybe you want to take it easy the next day, but you can exercise the next day. Yeah. All right.
So I got, can I be treated if I'm under Accutane?
Depends. It depends, right? So all of these questions, when people ask these questions, I don't know, it depends. Most of it. So what we do for patients on Accutane, so there's Roaccutane, for people who don't know, is an oral, very strong sort of vitamin A for your skin if you've got acne. It's a brand name. And you get a purging, and then you get very dry. Your skin gets very, very sensitive. Your top layer of skin thins very much. So chemical peels and all of that is off limits while you're on Roaccutane, and for some months after you stop. There are a few treatments that we do like microbotox, lip fillers, and certain other treatments, but we just have to be really, really careful, especially with infection control and keeping the barrier intact. So it's what you're using post-treatment is really important. So you can have treatments, just not the full Monty of treatments. So microbotox, light needling, but every patient is assessed. So if you're ultra sensitive, then we might give it a skip. Yeah, cool. All right, guys, thank you so much. If you have any more questions, I'd love to hear them. So drop them down in the comments below. Like, share, and subscribe. Bye.